Trauma informed care gets thrown around a lot in our profession right now, but I think there's a real gap between understanding it as a concept and actually knowing what to do with it when a patient is on your table. And today, we're closing that gap.
Hey there, I'm Jamie Johnston, and you're stepping into a new era of thriving as a massage therapist. We're embracing who you are, pursuing what you love, and confidently shaping your practice. We'll challenge industry norms, spark change, and discuss what truly matters. Things like mental health, evidence-based practice, and some topics we've long avoided. Let's create better outcomes for our patients and happier, more fulfilling practices together. Welcome to the New Generation Massage Therapist Podcast.
Welcome back to the New Generation Massage Therapist Podcast. I'm Jamie Johnston, and this is episode 3 of our series on trauma and the nervous system. In episode 1, we talked about what trauma actually does to the nervous system, how the amygdala becomes like a smoke alarm stuck on high alert. Then in episode 2, we looked at how trauma lands differently across our lifespan, from the epigenetic changes in a child's developing brain, to the allostatic load that accumulates in adults, to the reduced biological bounce back we see in older patients. But today, we get practical. Because here's the thing. Understanding the neuroscience of trauma is really important. But understanding it doesn't automatically tell you what to do differently on Monday morning when a patient comes in and something shifts in the room. So let's start with a definition, because I think this one gets misunderstood a lot. Trauma-informed care is not about treating the trauma itself. That's not our scope. And it's not what our patients need from us in the treatment room either. Trauma-informed care is about providing care that is sensitive to a nervous system, a person that's stuck in survival mode. It's about creating the conditions where a dysregulated nervous system can begin to feel safe enough to respond to treatment. That's it. That's the whole job. And the research has given us a really clear framework for how to do that. It comes down to 5 pillars. And I want to walk through each one, because I think when you see them laid out together, something clicks. Pillar 1 is safety. This is the foundation. Everything else builds on that. And as massage therapists, we naturally think about physical safety. Is the table comfortable? Is the pressure appropriate? Is the patient warm enough? But psychological safety is just as important. And honestly, it's the one we're less trained to think about. Psychological safety means creating a welcoming environment where a patient feels seen and not judged. It means listening actively and validating their physical symptoms, not minimizing them, not rushing past them. It means recognizing that something as simple as a lack of privacy in your clinic, say something like a door that doesn't close properly, a treatment room that feels exposed, can be enough to trigger a trauma response in a sensitive nervous system. Your room is not just a clinical space. For some of your patients, it's the first place they've felt safe in a long time, and that's worth taking seriously. And pillar 2 is trustworthiness. Trust is built through transparency and consistency. For a patient whose nervous system has been conditioned to expect unpredictability and threat, knowing exactly what to expect and having you follow through on it every single time is genuinely therapeutic. Practically, this means being clear about what you're going to do before you do it. It means maintaining firm, consistent boundaries. And it means taking informed consent seriously, not as a form to sign at the front desk, but as an ongoing conversation throughout the session. And it's important to take into account that informed consent isn't just about getting permission to work on certain areas of the body. It's also about giving a clear explanation about how our treatments work, what's happening when we put our hands on people, and making sure the descriptions of our techniques are accurate and up to date with current research. Pillar 3 is choice. Trauma can take away a person's sense of control. That's one of the defining features of a traumatic experience, the inability to stop what's happening. So, one of the most powerful things we can do as therapists is give it back. This doesn't have to be complicated. It can be as simple as asking which area they'd like to start with, offering a choice between, say, 2 different techniques, checking in and asking, is the pressure working for you, or would you like me to adjust? Small choices, but for a nervous system that's been conditioned to feel powerless, they're not small at all. Pillar 4 is collaboration. This one shifts the entire dynamic of the therapeutic relationship. And I think it's the pillar that changes us the most as therapists because we're trained to be the expert in the room. However, a collaborative approach means doing with your patient rather than doing to them or even doing for them. It means using inclusive language, saying things like, let's try this together, instead of issuing instructions. It means openly acknowledging that your patient is the ultimate authority on their own body, their own symptoms, and their own lived experience. It also means resisting what we can call the fix it push, that urge to apply the right evidence based treatment because you know it's what they need, even when the patient isn't fully on board. Adjusting your approach to what the patient agrees to and is comfortable with isn't a clinical compromise. It's trauma informed practice. And it means actively addressing the power imbalance that exists in the treatment room. Patients often feel vulnerable on the table, physically exposed, in a position of less power than the person standing over them. Recognizing that and actively encouraging them to use their voice, to participate in decisions, to push back if something doesn't feel right, that is collaboration. Pillar 5, empowerment. This is the one that I'm most passionate about. And I think it's the one that our profession under delivers on the most. Empowerment means moving beyond just physical treatment and actively helping your patient build confidence, coping skills, and self efficacy. It means co creating treatment goals together, not handing down a treatment plan, but building one with them. It means validating their strengths, not just cataloging a symptom. We're not here to fix our patients. We're here to give them the tools to feel capable and in control of their own recovery. And here's what I want you to notice about these 5 pillars: safety, trustworthiness, choice, collaboration, and empowerment. They aren't arbitrary. They map directly onto what the research tells us that every person needs in the aftermath of trauma, which are safety, calm, connectedness, resilience, and hope. That's not a coincidence. These pillars work because they're psychosocial contributors to recovery. And how we communicate inside the treatment room is what makes or breaks them. Because here's the thing: empowerment doesn't come from passive treatment. You can't massage someone into feeling capable. Empowerment comes from showing them in real time that they can move, that their body is safe, and that they have more capacity than they thought. That's exactly what From Fear to Functional is built around: the communication frameworks and the understanding of graded exposure. So you know how to safely and confidently start getting your patients moving again without triggering the very system you're trying to calm. I'll tell you more about it at the end of the episode. So let's get even more concrete, because I think collaboration is the pillar that's easiest to understand conceptually and hardest to actually implement in a session. Here's what it looks like in practice: use inclusive language. This is the simplest place to start. Swap out saying things like, I'm going to work on your upper traps now, for let's spend some time on your upper traps. Does that feel okay? The information is the same, but the dynamic is completely different. Treat the patient as the expert. You're the expert on anatomy, physiology, and treatment technique. They're the expert on their body, their symptoms, and their experience. Both are true simultaneously. When you operate from that place, the therapeutic relationship shifts. Resist that fix it push. This one is hard, especially when you can see exactly what the patient needs and you know the evidence supports it. But forcing the right treatment on a patient who isn't ready for it or isn't comfortable with it is not trauma informed practice. Meet them where they are. Address the power imbalance directly. At the start of a session, you might say something like, I want you to know that you're in charge here. If anything I do doesn't feel right, or you want to stop or change a direction at any point, please tell me. That's not going to bother me at all. That one statement can change everything for a patient who has been conditioned to feel like they don't have a voice. And what about when something goes wrong in the session? What do you do when a patient is triggered on your table? Your immediate priority is to reestablish their sense of safety. Watch for the nonverbal cues, things like a sudden shift in posture, muscle bracing, a change in their breathing. a facial expression that tells you something has changed. Check in, saying something like, "How are you doing right now?" If they are triggered, validate them first, saying things like, "I hear you, that makes complete sense." Remind them that they're safe. "I'm here with you, you're okay." And then give them a choice. Do they want to change pace, take a break, or stop physical touch completely? That restoration of choice in the moment they feel most out of control is genuinely therapeutic. You can also guide them through something as simple as diaphragmatic breathing, slow, deliberate breath that activates the parasympathetic nervous system and begins to bring that smoke alarm down from high alert. So let's talk about touch specifically, because touch is our primary modality. And with trauma affected patients, we need to navigate this carefully. For patients with a history of trauma, physical touch can feel like a violation of trust if the boundaries aren't crystal clear. This isn't about technique. This is not about pressure or positioning. It's about the relational context in which that touch happens. We need to move completely away from assumed consent. Assumed consent is the idea that because a patient booked a massage, they've consented to whatever we're going to do. And that's not good enough for a trauma informed practice. And honestly, it's not good enough for any practice. Explicit, ongoing consent means checking in throughout the session. It means narrating what you're about to do before you do it. It means leaving space for the patient to redirect you and genuinely welcoming it when they do. And it means being prepared to offer non touch options if a patient needs them. Things like guided breathing, adapted movements, verbal support, simply being present. These are all legitimate clinical tools. We can also actively help downregulate the sympathetic nervous system during a session by incorporating slow diaphragmatic breathing and body awareness techniques. Inviting a patient to notice the weight of their body on the table, asking them to follow their breath. These aren't soft add ons, they're evidence based tools that actively reduce pain perception by shifting the nervous system out of threat mode. And throughout all of it, validate their symptoms, reinforce their resilience, co create your treatment plan at every appointment, not just the first one. Because a trauma affected nervous system needs to know that the plan is built with them, not handed down to them. That's empowerment, and that's what moves the needle. So let's land this. Trauma informed care is not a personality type or a philosophy you either have or you don't. It's a set of concrete clinical decisions you make in every session. It's the way you set up your room, the language you use when they check in, the way you respond when something shifts, the choice you offer before you move to the next area, the breath you invite them to follow. The moment you say, "You're in charge here," and mean it. Safety, trustworthiness, choice, collaboration, empowerment. 5 pillars, every session, with every patient. Because here's what I've come to believe after years of working with complex patients: the person doesn't respond to a technique, they respond to safety. And safety is something we build deliberately, one clinical decision at a time. Next episode, we're going to talk about the cost of caring, what it actually means to support a trauma affected patient toward real recovery, and what that looks like as a long term clinical intention. If this series has been useful to you, share it with one of your colleagues. And if you want to take everything we've covered in these 3 episodes and build it into a real clinical framework, I've created a focused mini course called From Feared to Functional that does exactly that. It's $37, it's self directed, and it's built specifically for massage therapists who are ready to stop managing persistent pain and start understanding what's actually driving it: the fear avoidance cycle, the biopsychosocial model, graded exposure, and how to meet every patient where they are. Now, 3 episodes in, you already understand the why. This gives you the what and the how. The link's in the show notes. I'll see you next week.